Joe Alton, MD, also known as Dr. Bones of doomandbloom.net, where you'll find over 1,000 posts, videos, and podcasts on medical preparedness for any disaster. This is a hand fan, and sure enough, this is what my grandmother, my great-grandmother, even my mother in her youth used to keep cool in the heat of summer. Something like this hasn't been seen probably in quite a while, but indeed, it is something that you may wind up having to deal with if you lose the electricity this summer. And summer indeed is here, and the Midwest and East are experiencing record high temperatures in a major heat wave. Officials are predicting a high-risk situation as the heat index surpasses the 90s, hundreds, and in some cases, maybe even the 110s or so. Close to 200 million people might be affected in this particular heat wave, covering 32 states. That's according to the U.S. Weather Service. The heat index, by the way, is a measure of the effects of air temperature combined with high humidity. Above about 60% relative humidity, loss of heat by perspiration is impaired, and exposure to full sun increases the reported heat index by as much as 10 to 15 degrees Fahrenheit. All this increases the chances of heat-related illness. We can expect the power grid to be challenged by tens of millions of air conditioning units set on high, and we can expect to see some major health issues if the electricity goes out and people have to fight the heat with hand fans like they did in the good old days. Now, you might not consider a heat wave to be a natural disaster, but it most certainly is. Heat waves can cause mass casualties, as it did in Europe when tens of thousands died of exposure, not in the Middle Ages during the plague times, but in 2003. They've already experienced one bad one this year and are predicted to have another in the near future. India, Pakistan, other underdeveloped tropical countries experience thousands of heat-related deaths yearly. So how exactly does heat kill a person? Your body core regulates its temperature for optimal organ function. When core body temperature rises excessively, known as hyperthermia, toxins leak, inflammation occurs, and cells actually die. Fatalities can occur very quickly without intervention, even in those who are physically fit. In normal times, hyperthermia carries about a 10% death rate. That's in normal times. Mostly, that affects the elderly and the infirm. The ill effects due to overheating are called heat exhaustion if they're mild to moderate. If they're severe, these effects are referred to as heat stroke. Heat exhaustion usually doesn't result in permanent damage if dealt with, but heat stroke does. Indeed, it can permanently disable or even kill its victim. It's a medical emergency that must be diagnosed and treated promptly. Simply having muscle cramps or a fainting spell doesn't necessarily signify a major heat-related medical event. You'll see heat cramps often in kids who have been running around on a hot day, getting them out of the sun and massaging the affected muscles and providing hydration, very important, will usually resolve the problem. In addition to muscle cramps and fainting, heat exhaustion is characterized by confusion, a rapid pulse, flushing, maybe nausea and vomiting, headache, temperature elevation up to 105 degrees Fahrenheit, and that is just heat exhaustion. If no action is taken to cool the victim at this point, they could easily go on to heat stroke. In addition to all the possible signs and symptoms of heat exhaustion, heat stroke will manifest as loss of consciousness, seizures, and even bleeding seen in the urine or vomit. Breathing becomes rapid and shallow. If you don't deal with this emergency very quickly, shock and organ malfunction may ensue, possibly leading to death. In heat stroke, the skin is likely to be red and hot to the touch, but generally dry. Sweating might indeed be absent. Once the body core hits about 105 degrees or more, thermoregulation breaks down, and the body's ability to use sweating as a natural temperature regulator fails. In heat stroke, the body core can rise to 110 degrees Fahrenheit or even more. In some circumstances, the patient's skin may actually seem cool. It's important to realize that it's the body core temperature that is elevated. A person in shock may feel cold and clammy to the touch. You could be misled by this finding. It's important to take a reading with a thermometer to reveal the patient's true status. When overheated patients are no longer able to cool themselves, it's up to their rescuers to do the job. If hyperthermia is suspected, the victim should immediately be removed from the heat source. For example, get them out of the sun. Have their clothing removed. Be drenched with cool water or ice if available, maybe even wrapped up in a sheet with cool water or ice. Have their legs elevated above the level of their heart. That's called the shock position. Be fanned or otherwise ventilated to help with heat evaporation. And have moist cold compresses placed in the neck, armpit, and groin areas. Why the neck, armpit, and groin? Well, major blood vessels pass close to the skin in these areas, and cold packs will more efficiently cool the body core if placed there. Recent studies, by the way, by the military suggest that cold packs to feet and hands are also helpful. Oral rehydration is very useful to replace fluids lost, but only if your patient is awake and alert. If the victim has altered mental status, he or she might swallow the fluid into their airways. This causes damage to the lungs and puts you in worse shape than when you started. Heat stroke is preventable in many cases. People that should know about hot weather, the Arizona Department of Health recommends the following. Drink at least 2 liters, about a half gallon of water per day if you're mostly indoors, and 1 to 2 additional liters for every hour of outdoor time. Drink before you feel thirsty and avoid alcohol and caffeine. Wear lightweight, light-colored clothing and use a sun hat or umbrella to deflect the sun's rays. Eat smaller, more frequent meals instead of large ones. Avoid strenuous activity certainly at midday and any other time other than when the temperature is lowest. Stay indoors as much as you can. Take regular breaks if you exert yourself on warm days. That is very important. In a heat wave, it's important to check on the elderly, the very young, and the infirm regularly and often. These people have more difficulty seeking help, and you might just save a life if you're vigilant. There will be more than one heat wave this summer, so know the warning signs and how to help those with hyperthermia. In our next video, we're going to give you some tips on how to beat the heat at home, in the car, and on the road. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching. Begin your journey to medical preparedness with the Survival Medicine Handbook, the essential guide for when medical help is not on the way. Now in its 700-page 3rd edition, plus our new book, Alton's Antibiotics and Infectious Disease, the Layman's Guide to Available Antibacterials in Austere Settings. And last but not least, by checking out Nurse Amy's medical kits and individual supplies at store.doomandbloom.net. That's store.doomandbloom.net. You'll be glad you did.